Hey, I'm Dr. Davis. What can I do to help you today?
Well, I'm here because I'm just not happy with the appearance of my nose. I feel like the tip is just a little boxy, and I wanted something cuter.
All right, well, we have to look at your nose and just examining you briefly. You've got a couple of anatomical issues we could talk about. But first, let me ask you, do you have any breathing problems? Any airway obstruction?
At night, a little bit.
Okay. Well, we can look into that because sometimes we can correct some of that while we're talking about doing some surgery on your nose. Often the septum, the center cartilage inside the nose, is deviated. We often fix that. But most of the time we're talking about just changing the appearance of your nose, which is a cosmetic rhinoplasty. The common things that we often do is to lower the dorsum of the nose. We also do tip rhinoplasty work, which is the cartilage in this area of your nose. We can refine that. We can elevate the tip if needed. We can make that fit your face a lot better. So a couple of things we like to do. One, we'll take pictures. We'll put them on our computer imaging. That way you can see your photos, and we can, with the computer, alter that image so that you can see what the proposed surgery would do. And I think that's very educational to the patient. The way I do it is I do the imaging with the patient. That way I'm learning more from you also. I can tell if you like what I'm doing or if you're not so sure about what I'm doing. If you have your nurse or an office staff member do the imaging, I think you lose all that value. So when I do the imaging with you, I'll be doing it, and that way you can give me the immediate feedback if you like the new look.
Good.
But what we commonly do, as I told you, is to lower this dorsum as well as do the tip of your nose. But not everybody needs that. A lot of women and men just need tip work, which does not involve breaking the bones or lowering this cartilage through here. So that affects the recovery time. If we just do the tip, it may just be a week to 10 days of recovery. If we lower this dorsum and break these bones to recreate the nasal pyramid, you may get more bruising and more swelling, and the recovery time could be 2 weeks, up to 3 weeks at most. So in terms of discomfort, it really doesn't hurt that much, but you can get some bruising and maybe even some black eyes if we have to do the bone work. And you have to plan your schedule accordingly because of the bruising. But other than that, it's pretty straightforward. So we'll do the computer imaging, and then we can get a nice proposal for you to show you what a new, smaller, and refined nasal tip would look like for you.
Great. Thank you.